Do you know what periodontal disease is?
Gum disease?
Yeah. But you know what it's caused by?
No, not really. Plaque buildup on your teeth?
That's kind of, yeah. It's inflammation of your gums because of bacteria underneath the gums surface.
Okay.
Basically. And it can destroy fibers that hold your tooth in a socket or bone if it gets bad. So in health, your gingiva should be pink and pointed, and when you feel it, it should be firm. So there's 2 types of periodontal disease, gingivitis and periodontitis. Gingivitis is whenever it's swollen and red and your gums are like puffy, but there's no bone loss. But some fibers on top of your tooth can be destroyed if you have gingivitis, and usually there's bleeding with that. And periodontitis is like, see, that's gingivitis, and this is periodontitis. So see, you're losing bone with periodontitis. You don't lose bone with gingivitis. So basically, gingivitis is reversible, and periodontitis is not reversible. So once you start losing bone, you can't get that back. So you want to take care of your mouth.
Okay.
So, what do you think are some prevention methods that could be used?
Brush your teeth.
This? How many times?
Twice a day.
Okay. What about flossing?
Yeah, I think flossing is a measure you could take. I don't personally like to do it, but yes, I think it is.
On that.
Okay. Use a water pick.
Okay. I mean, that's flossing, kind of.
Okay.
Mouthwash.
Does mouthwash help?
I mean, mouthwash helps get out some of the bacteria, yeah, but you want to use alcohol for your mouth rinse.
Okay.
Helps flush out some bacteria.
Okay.
Well,
why do you want to use alcohol for your mouthwash?
Just because it's better.
Okay.
Okay. You can get education about it, like you're doing right now, learning. You can use other aids in between your teeth, like there's little brushes, little tiny brushes that can go in between your teeth. Control any systemic diseases that you have. Do you have any diseases, systemic diseases, that you could take medication
Allergies?
for?
No.
Anything like that?
No.
Okay, that doesn't really apply. And then you should always schedule professional cleanings.
Okay.
Because those are the only people that are going to be able to get the bacteria out from subgingivally underneath that. Because you can't do that at home. Okay. So, what do you think are some local risk factors for disease in your mouth?
Smoking.
Well, that's more of a systemic or contributing factor.
Oh, okay.
I'm talking about the in your mouth. But that is one, but not local.
Okay, so disease in my mouth.
What could cause that?
What could cause these?
In your mouth, things that you have. So like you said before, plaque buildup. If you don't take care of that, you don't brush twice a day, you don't get that, disturb that biofilm. If it just keeps accumulating, that can cause disease. Any tooth morphology, so if you have any teeth that are leaned backwards or verted or side to side, that just allows for the bacteria to get in between them a little bit and build up.
Like if you have spaces in your teeth or...
Yep. Calculus deposits. So do you know what calculus is? So that's below your teeth. So that you can't get that out. You have to get professional cleaning to get that out. Any restorations? You have fillings, anything like that. Or just appliances, like if you had a lingual bar or anything like that, which you don't, but if you did. Okay, so systemic risk factors be like medications, but you don't really take that. Smoking, like you said earlier, stuff like that. Contributing factors could be genetics or developmental factors or any habits. Do you have any oral habits?
No. Talking.
Okay, well, that's good.
You would mean biting your fingernails or... Yeah, I don't do any of that, no.
Okay. How do you think this disease can affect your systemic health? Just like your overall health?
Well, I mean, I think it could probably... It's bacteria, so that can make you sick.
Yeah. So if you have bacteria in your oral cavity, it can get into your bloodstream, obviously cause the rest of your body to get sick. So that can increase your risk for having a heart attack or respiratory disease if it gets into your lungs, or diabetes, or if you're pregnant, it can increase any premature birth or anything like that. And then it also can cause oral cancer. So you want to make sure that you take care of that. So, do you have any questions?
You said schedule regular teeth cleanings. What is regular?
Well, it just depends on your situation. So if you had, it just depends when you go. If you're just a healthy patient, you get regular cleanings. It just could be like 6 months, twice a year. If you have periodontal disease, if you have gingivitis, you'd have a gingivitis treatment and you'd come back probably about 3 months afterwards, get a checkup, whatever, make sure you don't need another gingivitis treatment. Periodontitis, you would have to have probably 3-month intervals just because you have that bone loss, so it would be more of a contributing factor. Just depends on your situation.
Okay.
Do you have any other questions?
No.
Okay. Sorry.
Thank you, friend.